Should you be applying an estrogen cream to your face? I have seen this question a lot here on YouTube. Let's get into it. Now, when it comes to skin aging, the visible signs of skin aging, without a doubt, without question, the main contributing factor to premature skin aging is cumulative lifetime unprotected sun exposure. Ultraviolet radiation from the sun damages the collagen in the deeper layers of our skin, leading to coarse wrinkles. It also damages the elastin, leading to loss of elasticity. We get rough, dry skin texture, sallowness, mottled hyperpigmentation. But there are other things, of course, that contribute to skin aging: genetics, smoking, drinking alcohol in excess, having a poor diet. But for women, we definitely have to have a conversation about the role of estrogen hormones in the visible signs of skin aging. During perimenopause and then menopause, you have a decline in estrogen. Estrogen is a hormone, binds to receptors to influence how different genes and different cells are expressed, resulting in different outcomes. What you see when estrogen levels decline in terms of the skin is you start to get a decline in collagen. As a matter of fact, within the first 5 years of going through menopause, a woman gets upwards of 30% loss in collagen in the skin. So you can start to see more obvious wrinkles. Estrogen is also really important for the production of things down in the deeper layers of the skin that like hold on to water and keep the skin hydrated. So the skin becomes a lot less firm. You get a loss of elasticity because you get a decline in both collagen and elastin. Then in the epidermis, you have a decline in the skin's ability to act as a barrier. You get a decline in natural moisturizing factors, so the water content of the stratum corneum drops. With that, the epidermis, the turnover of the epidermis and the normal exfoliation of the epidermis slows down because the enzymes there, they require that good water content to operate efficiently. That water content is not able to be teed up as easily, as readily as it once was due to decline in barrier function and natural moisturizing factors. Along with that, you also have problems with slower wound healing. Because your epidermis, the top part of your skin, it thins. In the epidermis, you have a system of antioxidants that helps to ward off oxidative stress that would prematurely damage your skin, damage proteins, DNA, lipids in the skin. Well, as the epidermis thins, you get a drop-off, a decline in antioxidant function. So your skin systems are less able to fight off free radicals. With menopause, many women start to experience dry skin, skin fragility, and because of the impaired barrier function, they're losing more water, but also things that are irritating get into the skin more readily. It's not uncommon for a lot of women to not only experience dry skin with menopause, maybe even for the first time. Like you may have been someone who had oily skin your entire life. Well, with that drop of estrogen and the changes in hormone profiles, you're losing that stimulus for even sebum production. So you may be like, oh my gosh, why are my skincare products being now so irritating? Well, a couple of factors. You have drier skin and the barrier is impaired. Things get in more readily, are more irritating. Now, beyond the skin, menopause is associated with a lot of very uncomfortable side effects, depending on the individual, of course. So herein you have hormone replacement therapy to address some of the symptoms of menopause as it relates to changes in hormones. These are medications that are given systemically, meaning to have hormones throughout the whole body. Now, with that, addresses symptoms like hot flashes, but we also see that women start to get some improvement in their skin on hormone replacement therapy. Better collagen, firmer skin, less dry skin, smoother skin, improvement in skin clarity. However, hormone replacement therapy is not right for all women. Hormones can influence the lining of your uterus, also can stimulate the breast tissue to proliferate, to divide. And if you have a history of breast cancer, may not be right for you. Hormones may impact your cardiovascular system in hormone replacement therapy, and may also, of course, put you at risk for blood clots and things of that sort. So not a one-size-fits-all by any means. One of the nice things about dermatology as a specialty is not only can we see things in real time, in a sense, on the skin as they are happening, but also a lot of our treatments can just be applied directly to the skin And because they're applied directly to the skin in many cases, that really, really cuts down on systemic, meaning total body exposure to the medication. You're just putting it in the skin. You are skin targeting for the most part. Now, when it comes to the skin, of course, it's a barrier. So you're always wondering like, well, if I put this on my skin, is it really going to get in and do anything? Turns out, estrogens and topicals like creams, gels, even the transdermal patches, which is a patch you put on your skin. Yes, they definitely can get in the skin and bind to those receptors. Well, they then go to work. The receptors activated can go to work to influence the expression of proteins and things in different cells in your skin. And guess what that culminates in? Restoration of some of the things that originally the estrogens were doing for you before you went through menopause. It's replacing it just there in the skin. So you see things with topical estrogen that might be desirable for you, not just cosmetically, but functionally as well. The topical estrogens, they can improve collagen production and elastin production in the deeper layers of the skin. So you get lessening of deep wrinkles, you get an improvement in fine lines, you get an improvement in skin firmness, elasticity, suppleness, and importantly, estrogens can help in improving the formation of healthy blood vessels. Estrogen, as it turns out, plays a role in the formation of the healthy blood vessels. So not only might you have a depletion of healthy blood vessels from sun exposure, but you also lose the beneficial property of estrogen in growing those healthy blood vessels. So applying it to the skin, you can start to see improvement in the vasculature in the skin. No longer so much just these dilated, sort of useless, dysfunctional blood vessels, but good blood vessels for bringing in growth factors and nutrients necessary for skin health and for efficient healing, which is another thing. Topical estrogens have been shown to improve wound healing times and better wound healing rates in general. So that is also a real beneficial thing that needs to be examined further in the setting of what we call estrogen-deficient skin. Not only that, but topical estrogen can improve the hyaluronic acid content in the dermis. So you get better water holding ability in the deeper layers. You also get improvement in the elastin in the deeper layers of the skin, not only just the production of it, but how it's oriented. Patients with estrogen deficient skin, when they start using a topical estrogen, they do get an improvement in water binding capacity of skin's outermost layer, the stratum corneum. So as a result of that, the natural turnover processes, they go a lot smoother, and as they go smoother, well, the skin gets smoother, more hydrated. Also, they get an improvement not only in the water binding ability of the stratum corneum, but in overall barrier function. So transepidermal water loss goes down, dryness improves, itch improves, the symptoms of sensitivity may improve. So a lot of benefits to be had there. And anytime you have an improvement in moisture retention, whether it be just in skin's outermost layer, the stratum corneum, but here in the case of topical estrogen, it's not just there where the moisture is getting better, it's also getting better down in the deeper layers of the skin. So you get firmer skin. But as everything is getting plumped up and the space is being filled again with volume that your body is making, well, you also get a visible diminishment in the appearance of pores. Most women are going to spend a very large chunk of their lifetime postmenopausal with estrogen deficient skin. So addressing these things is really important. You might be wondering, well, shoot, why not just slather every woman who's going through menopause and with menopause, why not just slather them all in estrogen cream? So what are the side effects? What are the negatives then of using an estrogen cream? Well, first of all, the studies that we have on using it and the experience that we have, it's kind of variable. All the studies, they look at specific things, and we can get into the limitations in a moment. But I would say as far as the side effect profile of a topical estrogen on the skin, it's actually pretty good. People don't really have side effects per se, even really much in the way of like irritation. Of course, anything you put on your skin can be irritating, but by and large, it's pretty well tolerated. Cream, gel. There are some instances where women do develop with a patch redness around the patch. Sometimes women develop breast tenderness with the patch. However, there is concern. Estrogen it does get in the skin, even though in theory it should just pretty much be in the skin. if you're applying it to the skin, especially over a large surface area, you really have to start to question, well, this is gonna, get absorbed into the body to some extent. And some evidence that we have to suggest this is the fact that in some of the studies, when women are applying estrogen to, say, their forearm, they're applying an estrogen cream, they're, looking at the forearm and it's like, wow, the pigment there looks better, the skin's firmer, the collagen there is better. But then they look at their cheek where they're not applying the cream and they're seeing those changes there too. So it suggests that, yeah, it could be getting absorbed into the body and because it's having effects outside of where the cream is being applied. Some researchers have even, monitored hormone levels to see is this actually getting in and changing a woman's hormone levels around at all. They've monitored what's called follicle stimulating hormone, prolactin, another hormone that can be influenced, as well as estradiol. Showed no changes. But research studies only are snapshots in time of what exactly they're looking at, so may not paint the full picture. The reason that's concerning is because, well, if it's getting absorbed in the body, those same adverse health effects that are of concern for some people with hormone replacement therapy, they're going to be a concern here. I really hesitate to encourage anyone to do this without talking to their doctor first, and whether or not it's going to be right for you. They do have their limitations, these studies, as do all. The studies themselves are not huge. In each study, while we have multiple studies looking at the effects of topical estrogen on the skin, each study uses either a different type of topical estrogen, they look for a different period of time, or they're looking at different outcomes. Some studies are looking at collagen, other studies they're talking to the patients and saying, is your skin still dry? They're looking for dry skin. Other studies are looking at wound healing, so different outcomes, right? And they're also looking at different body site locations. Some of these studies, women are putting it on the forearm, some they're putting it on sun-protected skin of the hip, others are putting it on the buttocks, face. So each of these studies, they're looking at a different body site. And the reason that matters is the skin at different body sites, it varies a lot. And also, some of these studies include another hormone called progesterone, which could, help to counterbalance any potential risk of uterine lining growth, which would be a concern of the absorption of the hormones from the cream. So those are topical estrogens. Estriol, estradiol, 17-beta estrol. We have some alternatives, though, that I think are worth mentioning here, besides, an estrogen cream, which would require a prescription. You can't just walk into like Walgreens and get this. First, you have MEAP, methyl estradiol propanoate, or MEAP. MEAP is found specifically in the product line Menopause. I reviewed this a few years. In contrast to estrogen, MEAP is not a hormone, but it does bind to estrogen receptors in the skin when applied to the skin in, say, a cream or a serum like this brand has, or an eye cream around the eyes. It binds to estrogen receptors on the surface of cells in the skin, like the fibroblasts, to, in theory, because this is a cosmetic, not a drug, encourage them to produce collagen, so having the same effects. But in contrast to a topical estrogen, estradiol, estriol, MEAP is inactivated, and so it's not absorbed into the body. So it removes some of the concerns about potential systemic side effects. So if you'll recall back to my video reviewing Menopause a few years ago, if you watched it, if not, check it out. Pretty much say the same thing today, but I will highlight a few points. First of all, it did show, it is promising. A lot of people do see improvement in fine lines, wrinkles, skin texture, skin quality, some of the visible signs of skin aging that are, brought on at an accelerated rate with menopause do seem to improve with those products with consistent use. And it's, again, one of those things, like pretty much anything in skincare, you have to continue using it in order to maintain those results. However, you've got to also look at what else those formulas have. They also, the cream and I think the serum, for example, they have niacinamide, which, can have some anti-aging benefits for improving the visible signs of skin aging. It's an antioxidant. They also have, I think, vitamin C, E, ferulic acid. They have peptides, which can improve moisture content. They also have, one of the products has retinol in it, which we know, can potentially improve collagen as well. So to what extent the outcomes people get with Menopause, which has MEAP, to what extent those outcomes are solely, or if at all, related to MEAP, the ingredient, is hard to say. It's definitely worth pointing out that unknown, because those products from McLellan are pretty expensive. Moving along, you also have phytoestrogens in skincare products. So phytoestrogens are structurally related to estrogens, but they're not quite the same thing. And they are a little bit more selective in terms of the receptors they bind. Kind of think of them as a weaker estrogen, if you will. So probably one of the more well-studied phytoestrogens for improving the signs of skin aging in estrogen-deficient skin is going to be soy isoflavones, specifically genistein. Genistein applied topically, it has been shown to improve collagen as well as elastin. It's been shown to improve the number of collagen and elastin fibers in the dermis when they go in and look under a microscope on biopsy. And it's also been shown to improve the appearance of wrinkles, to increase hyaluronic acid levels in estrogen deficient skin. So many of the same beneficial outcomes that you would be seeking from a topical estrogen, phytoestrogens, namely soy, isoflavone, genistein, they've been shown to do that to a lesser extent, honestly. Like, it's not as striking as the topical estrogens, but it's not, it's concerning for these potential systemic effects into the body because they're a lot weaker and, they're a little bit more selective in terms of the types of estrogen receptors that they bind. So genistein, it's a soy isoflavone, but it's found in fava beans. It's found in lupini beans. The other thing I will say about soy isoflavones is they're also antioxidants, which is good outside of the potential for them to have effects on the estrogen receptor. Just the fact that they're antioxidants, they may, depending on to what extent they are formulated correctly to get into the skin, they may offset some of the negative effects of environmental exposures generating free radicals. And as I said earlier, with menopause, you also do have, and menopause and aging skin in general, you start to have a decline in your skin's own antioxidant system. So that's another, potential perk of using something like genistein or soy isoflavones in your skincare. So, you can find brands out there in the drugstore that have soy isoflavones. I know No. 7 has a whole menopause line that has soy isoflavones. I've never used those products. I can't speak to how good they are. But Paula's Choice also has a phytoestrogen elasticity renewal body treatment with genistein and some other compounds from soy that are antioxidants, anti-inflammatory. And then of course, you also have retinol or retinaldehyde. Those are forms of topical vitamin A that you can buy in the drugstore without a prescription. Or you have, so those are cosmetic ingredients, but you also have the topical vitamin A retinoids, if you will, like tretinoin, which is prescription only, tazarotene, prescription only, Altreno, prescription only, and then over-the-counter acne treatment, adapalene. So those things definitely can improve collagen, can improve elasticity in the skin with ongoing use. You can get an improvement in wrinkles as well as mottled hyperpigmentation, an improvement in how the blood vessels are oriented in the skin. Lots of benefits to be had with a topical retinoid. As a matter of fact, check out my video on 5 perks of using adapalene besides acne. I go into a lot of this there, but that's one to really ask yourself, like, if you're thinking about this, but you're already using a retinol and you're protecting your skin from the sun, you're really doing the most evidence-based thing you can do. If you're interested in using a topical estrogen, like a prescription topical estrogen, definitely talk to your doctor before going on one of these like direct-to-consumer sites and getting one, because you want to make sure that it's the right thing for you. Like I said, there are a lot of unknowns with it, and it's not going to be the right thing for everyone. Anyways, guys, that's what I wanted to say about using an estrogen cream to improve the signs of skin aging. I hope this video was informative, helpful, answered your questions. And if you guys enjoyed it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.